Have you ever noticed a little stiffness or a subtle ache in your hip that just was not there before? It is easy to dismiss these small signals, but learning to recognize them early can make a big difference for your joint health. Identifying early hip joint discomfort often involves paying close attention to subtle changes in your body, especially during everyday activities. This proactive awareness allows you to address potential issues before they become more significant. The primary reason these early signs are so important stems from how hip joints function and the common conditions that affect them, like osteoarthritis. The hip is a ball and socket joint designed for a wide range of motion, but it relies on smooth cartilage to prevent bone-on-bone friction. When this cartilage begins to wear down, even slightly, it can lead to inflammation and irritation, which your body signals through discomfort. Understanding this underlying mechanism helps us appreciate why even minor symptoms should not be ignored. To practically identify early hip discomfort, start by performing a simple self-assessment during your daily routine. Notice if you feel a dull ache in your groin area, the side of your hip, or even in your buttock, especially after periods of rest or inactivity, such as getting out of bed in the morning. Pay attention to any stiffness when you first start moving, or if you find yourself compensating by shifting your weight or altering your stride. Consider how your hip feels when you climb stairs, bend to pick something up, or try to put on your socks and shoes. Any new difficulty with these common movements could be a clue. An insightful tip is to compare how your hips feel. If one hip consistently feels tighter or more restricted than the other, that is a significant indicator worth noting. Another valuable observation is any subtle clicking or popping sensation that occurs with movement, even if it is not painful. These seemingly minor sensations can be early indicators of changes within the joint, long before severe pain or significant mobility loss occurs. Keeping a small journal of these observations can be incredibly helpful for tracking symptoms over time. By tuning into these subtle cues, you empower yourself to take informed action. Recognizing early hip discomfort means you can seek advice from a healthcare professional sooner, potentially exploring conservative treatments like physical therapy or specific exercises. This proactive approach helps in managing symptoms effectively and can contribute to maintaining your mobility and quality of life for years to come, turning small observations into meaningful health improvements.